In a triage, we're looking for good for a lot of people. Because if you're going to die, then I don't need to waste resources on you because I want to save a lot of people. So save a lot of people with that resources you have. It's different from regular trauma. And then they have colors. They have like red, okay, they have yellow, green, and black, okay. And each of them, they label them. The red is basically is emergent, okay. So red is emergent, and the yellow is urgent, basically, and the green is non-urgent. With the black is expectant. That means they're going to die. Guess what? Make things easy for yourself. For the exams, okay, you shouldn't worry about the yellow and the green because they're going to ask you about who do you prioritize. So I want you to focus on two things. Red patient. Just learn how to identify a red patient. Don't worry about yellow. Don't worry about green. If you are in nursing school still, yeah, you need to do yellow and green in your exams. But for the boards, care about red. And the red, there's only 4 things I'll tell you. Patient is in shock. It's red. Okay, that means their blood pressure is low, but you will not even have the chance to measure their blood pressure. They won't give you that because you are in the scene of the trauma. So you basically observing the patient that is in shock. You see a lot of blood. There will be a little bit of pale in color, skin changes. Yeah, you know they've lost blood. So shock, they have acute change in mental status, and you see blood all over their body. Yeah, that's a sign of shock. So you won't have blood pressure unless they give you blood pressure, but you won't have that. Okay. And then airway. You just look in and see if there's airway. You check for strident. You can hear it. You can see chest movement, paradoxical chest movement. You see a sucking chest wound. All these things. You see them. You lift their head up. They're not breathing, and you listen. Yeah, observation. That's the airway problem. And then chest trauma. Anybody that had injury to the chest, no matter what, stab wound, rib fracture, anything wound that is open on the chest become a priority because it's a chest wound. Chest trauma, just group them into these 2 areas. Chest trauma is a priority, no matter what they look like. Okay. Because the chest trauma will affect your airway and bleeding. That's the reason why. Chest trauma is an airway problem, a breathing problem, and even a circulation. So ABC there. Okay, that's why every chest trauma become a priority. And then if they have a wound that is unstable, okay, the wound that is not unstable, like if you have amputation, okay, that's a sign of hemorrhage. Or they have like fracture, okay, and you don't feel any pulse, yeah, they're going to lose their limb. So that patient, you can just immobilize explain the fracture quickly and allow blood to supply. Or they have amputation, or they have a wound that is bleeding, is unstable. These are the 4: shock, airway, chest trauma, unstable wound. Don't worry about anything. Then the black, okay, the black person. The black, which is expectant. Expectant, that's all you need to worry about. Patient has no pulse. So no breathing, no response, unresponsive, and no pulse. You check their pulse, they have no pulse. You shake them, they're not responding. I'm not going to do anything about it. If they have severe brain injury, so you can see actual penetrating wound to the head, okay? Head injury, you can see that like a brain matter is exposed, okay? Brain matter is exposed. Yeah, that's the problem. That's a severe. There are people, okay? That's how you can assess quickly neurological function. It's fixed and dilated. Yeah, that patient, no. If the patient has no airway, is not breathing, okay, you lift their head up, you move your jaw, You try to open and there's the apneic is an expected patient. Don't waste your time. And then lastly, if they give you a burn patient like almost like 70% of the body surface injury, don't worry about it. So these two, I care about red, I don't care about black. And the one in the middle, I'm not even looking at it. So you're giving 4 answer choices. You just go down and say, I'm looking for shock, airway trauma, and chest trauma and unstable wound. Shock, airway trauma, chest, unstable wound. Then I'm also looking for somebody who's an expectant. In between them, they are not a priority because then they confuse you more. The yellow and the green confuse you to get the red. So in order to get rid of the confusion, focus on the red and the black. So if I know you dead, I don't worry about it. And if I'm looking for these key factors: shock, airway, chest trauma, and wound unstable, then yes, those are my people. So make triage scenario easy. You read a book, you listen to other people, they'll give you so many yellow, green. I think in order to help yourself improve your chances of finding the right patient, you have 4 patients. If you cut that into 50 and 2, now your chance of picking the right answer is 50%, okay, rather than 25%. And since the black is very specific, if you have too much injury, then you'll be left with the red. So that is my strategy. And I think that's the best way to do it. And so now we have the triage scenario. Who do you transport first to the trauma bay? Okay, and I told you look for what? Red and black. I'm not looking at anybody in between. Red and black. A client with fixed dilated pupil and brain matter exposed. Is fixed pupil, I mean, that patient is not surviving. So this is black. A client with multiple superficial laceration of the body is not black, it's not red. I don't care what color is there. I don't going to even assign anything to him. Multiple laceration doesn't mean anything. They're not telling me he's bleeding. All you're looking for is shock, chest trauma, airway, and unstable wound. That's red. A client with 80% of total body surface, this patient is not surviving, is black. A client with no pulse and unresponsive, this black, is not going to survive. A client with sucking chest wound, yes, I will assign something. This is red. Those are the 2 I need. A client with traumatic amputation and clot and the cloth saturated with blood, that is red. It's bleeding. Clothes saturated with blood, that means he has bled, he has hemorrhage. So it's in shock. It's part of my red. A client with audible stridor and bruising over the neck. Yes, stridor is an airway, so that's red. So this person need to be, this person need to be, this person need to be. All the rest, no. So just focus on the black and red. The other ones, don't even assign them.